Hi, thank you for joining us. My name is Inga Hansen. I'm the executive editor of MedEsthetics Magazine. For more than a decade, we've been creating content geared toward helping medical spa and medical practice owners run their businesses more profitably, more efficiently, and all while providing the best possible patient care. One of the questions that we hear over and over again from our readers is, how can I improve my conversion rates? Practices spend a great deal of time, a great deal of money, and a great deal of energy trying to bring prospective patients to their door only to watch them walk away without booking a procedure. It can be frustrating, it can be disheartening, and it can in the long term damage the health of your business. And this is why we, along with generous support from Canfield Imaging Systems, are so excited to introduce Francis Acunzo. Francis is the CEO and founder of Akara Partners Consulting. He's the CEO and founder of Reach Beyond Digital Marketing. In 1996, Fran and Candela Lasers joined forces to launch the very first medical spa in the United States. In 2006, he was hired by the largest medical spa chain in the country to help them come back from the brink of bankruptcy and get on a path toward profitability. In the years between and the years since, Francis and his team have been traveling around the country working with medical spas, working with private aesthetic practices to help them improve their business operations. This is through staff training, through new marketing strategies, and through training on how to improve conversion rates. Today he's going to be presenting his 8-step strategy that starts at the very first point of contact and continues all the way through the booking so that he can help you better communicate why you are in fact the best provider to meet your prospective patient's unique aesthetic needs. Welcome, Francis.
Thank you, Inga. It's a pleasure to be here today to discuss with everyone from consult to patient the 8 steps to improve your conversion rates. Okay, let's start by looking at what are the 8 steps. First, greeting. Second, practice overview. Third, discovery process. Fourth, benefits and features. Fifth, plan and pricing. Sixth, test close. 7, overcoming objections. And 8, the close. Now keep in mind, the first 4 actually go in order. Typically, the greeting, the practice overview, the discovery process, benefits and features go in that order. Those last 4 can be happening at any time during the process. All right, let's take this one step at a time and begin with the greeting. All right, first, create a warm and welcoming environment. Take a look at your waiting area, your reception area. Make sure it's a place that people want to be, that people are greeted in a warm and friendly manner by your reception team. Very important, acknowledge the client immediately. So whoever's at the desk should, even if they're on the phone, look up with the 1-minute sign or smile as they're on the phone, as they're acknowledging them with their eyes. And of course, if they're not on the phone, to look up immediately and welcome them to the practice. All right. Next, you have the patient coordinator coming in to the waiting area to welcome them and take them to their consultation room. So why don't we take a look now at how this happens in real life.
Hi, Beth. I'm
Hi.
Colleen, Dr. Smith's patient coordinator.
Oh, nice to meet you.
Nice to meet you. We're going to head down this way where we'll be
right.
doing the consultation today.
Perfect.
Okay, what did we just see? Colleen was walking towards the person, forward momentum, her hand was outstretched, she was calling her name, all very positive, all very warm. She shook her hand, which is a very common, comfortable first point of contact with somebody, and then used body language and verbal cues to have her then walk towards in the direction of the consultation room. That's the right type of interaction. Warm, friendly, very, very positive. Okay, so now let's look at the next step, practice overview, step number 2. The practice overview is to build credibility and trust. It's to discuss unique selling points, present points of differentiation, and provide an overview of the medical staff. Now let's see what that looks like.
Well, so I'm so glad you were able to come in today, Beth. I know this is your first time here. I have your paperwork that you filled out. So how much do you know about the Smith Aesthetic Center? Have you done any research?
Not a lot. I found you on the internet, actually.
Okay, great.
And that's why I'm here.
Okay, well let me tell you a little bit about the practice, about Dr. Smith, about our staff. By all means, anytime you have any questions, please ask. So Dr. Smith has been in practice for over 25 years. She's a board-certified dermatologist as well as board-certified in cosmetic surgery. We have 3 nurses on staff as well as 2 estheticians. We have a number of different lasers, so we can treat all different types of skin conditions. I know you did mention that you do have some concerns about the overall look of your skin. We also have an accredited surgical suite.
Wow.
So we've been doing this for a long time.
Great.
Okay, so what did we see Colleen do during the practice overview? She started by asking the question, how much do you know about our practice? This is helpful because you want to cater what you're saying to your audience. If the individual knows all about the practice, maybe had been there 3 or 4 years ago before Colleen was a patient coordinator at that practice, she's not going to go into as much detail. Or maybe she's going to focus on things that have happened in recent years since that individual had been there. So that's a very important starting point during the practice overview. Next, notice how she talked about the practice's unique selling position, the double board certified physician, the fact that he has 25 years of experience. This is really solid, and a unique selling position is tough to be competitive against. There's not too many physicians that have 25 years and double board certified in the market. And then lastly, points of differentiation. Now this location happens to be an accredited surgical center, and that is a point of differentiation that Colleen identified during the practice overview. Essentially, what is Colleen attempting to accomplish? She wants to make her practice bigger than life. She wants to make it seem like there's nowhere else but this practice for the procedure that is being discussed that day. Okay, step 3, the discovery process. All right, during the discovery process, you're trying to determine the needs and the wants of the patient, the customer. You're looking to uncover the emotional and lifestyle desires of that person, and you want to continue to build rapport and be empathetic and relate to that person's experiences. It oftentimes can be started with something very simple like an open-ended question. Tell me a little bit about yourself. What brings you here today? And what are we specifically looking for? 1, the lifestyle discovery. Now, what their marriage and or family is all about, what their work life looks like. Do they travel a lot? Are they sedentary? Health concerns they currently may have, current skincare that they use. Now let's take a peek in to see what Colleen does to help discover the lifestyle of Beth.
So tell me a little bit about yourself. I know that you did give me an indication of some of the things that you're interested in, but tell me about you. Do you currently work?
I work full-time, and I am, about me, work full-time, don't have a lot of time, so that's certainly one of the concerns I have about, correcting or changing some of my issues. Is how much downtime I'm going to have, how much I'll have to be away from work. But I overall am just tired of the sort of redness and sun damage that I have on my face. And I have a big birthday coming up, so I was kind of thinking about maybe finally doing something about that little tummy thing I have going.
Okay.
So.
And I do see that your birthday that you put here is coming up in about 3 months.
Yes.
Okay, so, all right. And currently, what type of skincare products are you using? Are you happy with what you're using?
I think so. I mean, it's, I go to the department store and they recommend what I use. And I've probably been using, Lancome and some of the other department store brands.
Great, okay.
Okay, great. So, what's next? Well, it's that emotional discovery that is so helpful in knowing the motivation of the potential patient. Did they go through a recent divorce? Was there a death in the family? Possibly a recent weight loss or gain? A search for a job, a new job? Did they just recently lose their job? There's also life celebrations. I had a wedding coming up or an anniversary that I want to look special for. So that is also important to discover, this emotional discovery. And also, it's important to identify not just what they want, but also what they need. And sometimes those align nicely and sometimes they don't. And oftentimes they need more than what they came in wanting. So, we want to know, typically the patient identifies what they want, and it's up to the person doing the consultation to identify the needs. Again, let's look and see how Colleen identifies a need or some needs for Beth.
As we talked about earlier, we're going to be taking your picture with the Vizia. It's a complexion analysis device. I've already entered all of your information into our computer. What's nice about this, it's going to allow me to give you an access code for an online portal. So at the end of our visit today, you can go home and actually view the results in the comfort of your own home.
Cool, very nice.
Yes. So what we're going to do is we're going to take an image of your face. This does 3 angles. So what I'd like you to do is take off your glasses, please, and put your chin in the cradle. And we're going to start with your right side. Okay, close your eyes and we're going to be able to take your photograph. Okay, it's as easy as that. Okay, Beth, so as you can see, what's nice about the Vizia is it highlights different areas that you came in today of concern. Your brown spots, wrinkles, texture, and pores. This is showing your actual age, which of course we know is 59. Your true skin age is showing at 69. So we have some treatments that we're going to talk about a little later that are going to help to bring you back closer to your actual age of 59.
I am just curious, how does this, that doesn't even look like me.
Oh, well, what's nice about the Vizia is we use different lighting modalities and enables us to see different areas beneath the skin.
Wow. That makes you want to do something.
And we're going to talk about your different treatment options.
Perfect.
Okay, it's important throughout this process to listen intently and take notes. 1, the notes are important for you, and 2, it actually shows the potential patient, client, that you are listening. Right? So make sure you do that. You noticed probably Colleen was taking some notes when she was speaking to Beth. At the end, recap what you've discovered. What are the goals, the concerns, and the limitations that you want to recap, and then summarize and prioritize. So they may end up needing 5 different things. They may have only wanted 2 or 3, but they actually need 5. But you don't want to price out all 5. You want to probably price out the top 1, 2, or 3 priorities and start there. So why don't we see how Colleen identifies what are the priorities and also summarizes the discovery process.
So let's talk a little bit about some of the treatments we have for the areas that you've mentioned. I know you did say that you'd like to do something for your face, so we do have a few treatments for that I think may be a good solution for you. Also, in terms of getting rid of that little area in the stomach, we have a couple of options for that as well.
Right.
So what I'd like to do is to show you some photographs, and we can talk a little bit about the benefits and features of the procedures that I think would probably be a good fit for you.
Okay, great. Now that we've gone through the discovery process, it's time to explain the benefits and features of the solutions that are identified that align with the needs and wants of the patient. Right? So you want to present the solutions. You want to present the benefit. Now, benefits are results. You want to present the features. The features are what makes the solution credible, the tangible aspects that make it special or different. And you also want to present before and after photographs. So, the benefit, the outcome or result the client receives. An example is laser lipolysis, permanently removes fat. Let's take a look at Colleen as she discusses with Beth a benefit.
So let's start with your face
Okay.
and that area. So I think, and I'm going to just show you, There are a couple of different options. I know downtime is a concern of yours. So what I would probably recommend to start out with, since you have never done any of these treatments, is something called a photofacial series. It's a quick treatment, typically takes about 15 to 20 minutes.
Okay.
You sit with a topical anesthetic cream on your face to start out with, and then one of our laser technicians would come in after the doctor has made an assessment and will provide the treatment. What's nice is it's going to help to take care of the reds and browns in your skin.
Okay.
So that's one option. Another option would be a series of a more aggressive laser resurfacing. And let me show you those photographs right here.
Wow.
There is more downtime with that type of procedure.
Right.
The results may be a little bit better,
Wow.
but if you are concerned about downtime, we may want to focus to start you out with the photofacial
Well,
series.
Depending on how soon before the birthday. So
Okay.
we'll use that as our as our gauge.
Great. Now let's talk a little bit more about options that we have for that stomach area that you're concerned with. We can do something a little bit more aggressive, a laser lipolysis procedure. That there will be probably 3 to 4 days downtime. It's
Okay.
done with local anesthesia right here in our office. As I said, Dr. Smith is board certified in cosmetic surgery as well as dermatology.
Oh, wow.
What's nice is with local anesthesia, you're wide awake, so it's a safe procedure to have. We can talk a little bit more about what's involved with that, but let's talk also, and let me show you some other photographs of a non-invasive procedure. There are a few non-invasive procedures, cool sculpting or sculpture, and we actually offer both.
Oh, wow.
So as you can see from the photographs, the results may be a little bit less dramatic than with a laser lipo procedure,
Yeah.
but we can get into that a little bit more.
All right.
All right, next, features. All right, these are the tangible aspects that make the solution special or different. Also builds credibility for the solution, right? So an example here would be we utilize latest laser technology, Cyton Technology, one of the country's top laser companies. Okay, now that we've reviewed benefits and features, we can reinforce them with before and after photographs. Before and after photographs are your #1 selling tool that any practice can have. And it's so important to take really great before and after photographs. It's also really important to present them in a way that it's professional. You know, it's amazing that 25% of the time we go into practices and they have no before and after photographs. 25% of the time we go into practices and they have really poorly taken before and after photographs. 25% of the time we have good, solid before and afters, but they're really poorly presented. And only 25% of the time when we go into a new practice are we seeing great before and after photographs presented very professionally, whether it be a beautiful bound book, on an iPad, up on a screen. It's such an incredible tool when it comes to selling cosmetic procedures. You really want to do this right. All right. So, as I say, a picture is worth 1,000 words, and it builds customer confidence. The other thing, too, that I just want to mention before we take a look and see how Colleen presents before and afters is the fact that you don't really just want 1, 2, or 3 before and afters of each procedure. You want 8, 9, 10, a dozen, or more. The reason you want to do that is because you want to have the potential patient being flipping through before and afters, and they identify themselves in the picture, whether it be weight, age, color, gender, and that's like sort of an aha moment. Oh, I look like that, and wow, look at the result. It helps a lot, and oftentimes it's a really strong closing tool. So let's see how Colleen presents before and after photographs to Beth.
Why don't you take a look at some of the photographs that we have here. You can see it's very easy to navigate.
Yeah.
You can just take a look at the different body contouring photographs as well as the laser resurfacing. So
That looks exactly like what I'm looking for. That could be me, I think, and maybe that could be my results.
Absolutely. So why don't I go and put together a plan and some pricing, and I'll be back in a few minutes.
All right, thank you.
Before we close on benefits and features section, I just want to identify a few very important items. You want to be aware of managing expectations. Never oversell cosmetic procedures. Okay, so you want to manage those expectations, make them understand that you could potentially achieve the results you see in the before and afters, but it's not definitive, it's not always accomplished. You want to avoid information overload. We find when clinical personnel perform consultations, they tend to want to talk more about the technical aspect of the procedure. You want to keep it very simple. Here's the benefit, here's the result, and here's a few reasons why, features, that you want to have this procedure. So keep the terminology and the technology as simple as possible. Speak to your audience too, though, when it comes to this. Sometimes you have somebody in front of you that has done a ton of research, and they enjoy hearing how many joules you have to fire off the laser. But most of the time, the audience will find that to be over information, and you'll lose them, and they'll shut down on you. So manage the expectations, keep it as simple as possible, avoid information overload. So now that we have discussed the first 4 steps of our 8-step consultation, let's identify why those are linear, all right? You're always going to do a greeting, number 1. Number 2, you're always going to give a practice overview. Then 3, after that, you have to go through a discovery process. You have to find out what they need and what they want. And then finally, you're going to align those solutions, identifying benefits and features of those solutions, with their needs and their wants. Thus, 1, 2, 3, and 4. Every great consultation has those 4 steps in a linear fashion. Now, steps 5, 6, 7, 8, plan and pricing, test close, overcoming objections, and the close. They can be interspersed in steps 2, 3, and 4. All right? Hey, after going through the discovery, somebody says, I just want to do this, go right to the close. Don't say I have 3 more steps, just go right to the close. All right? Hey, throughout those first 4 steps, and really 2, 3, and 4, you're going to do test closing, and we'll talk in a few minutes what test closing is. You may jump into the plan and pricing because they're insisting, and you're not wanting to upset them. So you may discuss plan and pricing before you even get to benefits and features. It just happens that way, but always take the time and go through those first 4 steps. Greeting, practice overview, discovery process, identify the solutions, and discuss the features and benefits. Okay, step 5, plan and pricing. What you want to do is take a quote sheet and review the solution and the cost that you've written up on your quote sheet. Identify the date the quote is valid until. Make sure they know that this quote is valid until a certain date, especially if you have monthly specials or bi-monthly special offers. You want to identify that so they're very clear as to when the offer is good until. And then, of course, discuss in detail any special offers. Let's take a look and see how Colleen presents plan and pricing to Beth.
Okay, Beth, so here we have the different areas that you voiced a concern. I have a price for laser lipolysis. As you can see, we are offering $500 off. That is only till the end of this month. We do have a couple of non-invasive body contouring procedures, and I've listed those as well. And I've also listed a series of photofacials that I think will be terrific for you in terms of addressing those areas of the skin that you had some concerns.
All right. So step number 6, the test close. All right. Test close identifies the individual's readiness to want to move forward and have the procedure or the service. It also uncovers objections, which is very important to understand, and we're going to talk in a moment about objections and how to overcome objections. So let's take a look and see what a test close, a few different test closes actually look like.
So what do you think? Should I take a look at the schedule and see?
Well, I'm not sure. So the price, let's talk about the price. I do know that I saw a couple of, on the internet when I was looking, some other practices that did have the price. And so this is the price for it sounds like the laser lipolysis that you were talking about is the best option, but that, I don't know if I'm able to afford that right now.
Okay, Beth. So let's talk a little bit more about your timing. when were you thinking you'd like to have this procedure done? I know that you've got a big birthday coming, and I did mention that we are booked for the next few months. I think we can probably squeeze you in, but talk to me a little bit about that.
Well, I want to be everything to be complete, feeling good and looking great by my birthday. So
Okay, so we're going to have to really work on the schedule. Okay, Beth, it seems like you're hesitating a little bit over the solutions. Is it the price you're concerned with? Is it the procedure? Let's talk a little bit more about that.
Well, it's a couple of things. It is the price.
Okay.
But, I mean, I think that's the biggest thing, maybe. I'm not sure. The price is just something I need to talk to my husband about. And I'm a little bit concerned about downtime.
So there you saw a few examples of test closes. And in addition to that, you saw how a test close brought up an objection or two. And make sure, it's so important that you embrace objections, because it's only through overcoming the objections are you going to actually close the sale. So you are looking to have the potential patient or client identify, or you're looking to uncover every single objection that there may be. So this is a list here. We say address any noted objections. You don't want to shy away from it. You want to address it, okay? You want to discuss the objections in the order of priority. So actually write down all the objections. And then prioritize what are the objections. And again, address those objections. Common objections include price and value. Okay, so price has to do with perceived value of the procedure. Like, I may have the money to do this, but wow, I just think that sounds very expensive for the procedure you're telling me about. Cost, that has to do with, okay, it may be worth that money, but when I reach into my pocket, I don't have the money to spend, so that's the cost objection. Spouse or significant other is a common objection. You know, worried what they will think. They think I shouldn't go into a surgical procedure. They think that I shouldn't spend the money on this type of service. Downtime or schedule. Oftentimes a busy career person who has limited downtime and their schedule is tight, they're going to have those objections. And to some degree, pain and discomfort. Not everybody wants to go through all of these procedures. If there's any pain and discomfort involved, that's probably the least important of the objections that we see. So let's take these one at a time, and let's take a look at a price objection.
So, what do you think?
So this is the price now for the laser lipo.
Yes.
So I have, as I said, found you guys on the internet, and I have looked at some other practices on the internet, and this does seem to be a little more expensive than some of the other ones that I have seen.
Okay. Well, Dr. Smith does have 25 years of experience doing lipolysis, and in particular has done a number of laser lipo procedures. So we've performed probably more than any of the other physicians in the area. So I would say that's something important to consider when doing your research online, or if you're going to another practice and consulting with another physician group, the years of experience.
Yeah.
Now, you noticed how the solution with the price objection was to build the value based on the credibility, the results, the number of procedures performed. Essentially, go back to your practice overview section and press the hot buttons. Why is it cost this? Or why is this the price? 25 years of experience. More surgical procedures performed than any other physician when it comes to this procedure in our market. You know, these are the reasons why it's priced at that level. Colleen did that very nicely when she was speaking with Beth. Now, next is the cost objection. It costs more than the person is willing or is able, really, to spend. Let's see how we overcome that objection.
So now this is the price for the lipo. Wow, I'm not sure if I can pull that off right now. That's a lot.
Is that more than what you
It's
expected?
more than I thought it would be. It really is.
Okay. Have you ever considered financing? Because we do offer financing through Alpheon. And as a matter of fact, I have it right here because so often, so many of our patients that come in will pay for all of it or even a portion of it with a financing
Oh,
company.
wow.
So what's nice is we are offering currently 12 months interest-free financing through Alpheon Credit. How this works, it is a line of credit that you apply for. You'll be qualified instantly over the phone, or we could even do it this afternoon. I can have you just enter your information right here and you'll know if you qualify, and then we can get you started.
All right, that makes a difference.
Okay.
As you notice, Colleen went right to financing. And really what's great is zero interest, no interest, 12-month financing. It is a bell ringer in this country to overcome the cost objection. Would you like to spend $1,800 today or spend $150 a month for the next 12 months and it won't cost you any interest? Easy to overcome the cost objection with no interest financing. Next one is spouse or significant other. Let's take a look and see how Colleen overcomes that objection.
So this is the price for the laser lipolysis. You know, maybe I need to speak to my husband about this
Okay.
first. Just let him know that which one I'm thinking of, get some feedback from him on.
Of course, yes. Now I will tell you that we are booked for the next couple of months. So what I'd like to suggest is that we take a look at the schedule. Let me at least give you a couple of dates that are available with Dr. Smith, just so that you can keep that in mind when you do talk to your husband about possibly having the procedure. Why don't we set up a time for a call for you and I to discuss what you and your husband have discussed? Can we set up a time for a call?
Sure.
Okay.
Sure.
I know
Let's
you're
see, when
busy
you're
at
talking
work.
about in the next couple days,
Yes.
perhaps. Yeah, you have my office number.
I do.
So that's fine. You can call me there in the morning or the next day, and I'm going to
Perfect.
talk to him tonight.
Great. Okay.
So there, Colleen had a simple solution. Bring your spouse in. Let's talk as a group and make sure that they're on board and they understand that there's no danger here, or there's a limited danger, of course, manage expectations, but they shouldn't be worried. We've performed 2,000 of these procedures. It's under a local anesthesia. We're not doing general anesthesia, things of that nature. Next thing is downtime or the schedule. And so there are a few different solutions here. Let's see how Colleen handles downtime or difficult, tight schedules.
Any questions about that? Because I'm going to look at the schedule right now and see when we can get you scheduled in for that.
Well, now, how long will I know I have to have the procedure, but then how many days is it going to take for me before I can go back to work?
That's a great question. So I know you're very busy at work. So what I would recommend is, do you have any vacation time that you could take perhaps? You're going to need probably 3 to 5 days of downtime. So what I would suggest is maybe taking a half day on Thursday, taking Friday off, and then you'll be back to work by Tuesday. Is that something that might work for you?
Well, I do have a couple vacation days I could probably squeeze into a weekend, so that may work.
Okay, great. So right now it looks like we have an opening in about a month, which would put you in a perfect situation for that birthday. Should I schedule you?
Tell me what those dates are.
Okay, we are looking at May 17th.
Okay, so Colleen was able to overcome this objection by getting a little creative, scheduling the procedure at the end of a week. That was a long weekend. And the person said, yeah, I can actually do that. I can take half a day Thursday and Friday off. And that way I have all day Friday, Saturday, Sunday, Monday with downtime, back to work on Tuesday. All right. Finally, the pain and discomfort objection. Let's see how Colleen discusses the situation with her potential patient.
You mentioned that you do use a topical anesthesia. I'm not really very good with pain at all.
Okay.
That kind of makes me nervous if they have to numb me.
Okay. Let me tell you from my personal experience what it felt like. So your face is going to be numbed with a local anesthetic cream, and then the laser is going to feel almost like an elastic band being snapped on your skin. It's uncomfortable, but it's manageable. But again, the results are going to be so well worth it.
Well, maybe I can handle that.
Okay.
Okay, so it was clear how Colleen overcame the objection, the pain and discomfort objection, talking about her own personal experience with the procedure, talking about the pain management that was used with a topical in this situation. If you have somebody else in the office that had the procedure or the service, have them join and can talk or speak with the potential client as well. That could work nicely. Now, what's the last one on the list? Number 8. It's the close. Before I start with discussing the close in any great detail, let me start by saying every great sales consultant closes 100% of the time. Okay, you're like, what do you mean 100% of the time? Well, a great sales consultant only asks for the close when they know they have overcome every one of the objections that have been identified on the list. Right? If you cannot overcome an objection, do not ask for the sale. One reason, it's going to come across as pushy. And you never want to come across as pushy because you're leaving a lasting impression on that person. They don't buy from you today, they will buy from you tomorrow potentially. Or they'll be sitting at brunch with their sister and their friend, and one of them brings up a procedure or service that you were thinking about, and what are you going to do? If you had great feelings about the practice where you had that consultation, you're going to say, wait a minute, I know exactly where you should go. So they're going to be an ambassador if you handle this right. So only ask for the sale if you have overcome every one of the objections. And if you can't, that's fine. Shake hands, give them a smile, let them go on their way, and believe that they will be back, or a friend or family member will be back at some point in time to be a patient at your practice. All right, so what is the close all about? The close is very simple. You ask for the purchase. Great, let's get started today. I'll take a deposit of $500. That's asking for the sale. You facilitate the purchase and other payments or appointments. Let's get you on the books. Let me see what's available. Great, I'll take your credit card and run it for the deposit. And lastly, and as I was saying earlier, never ask unless they're ready. Let's take a quick look as to how Colleen asks for the sale.
Okay, Beth, so now that we've addressed all of your concerns, let's get you started. What we do take is a $500 deposit, and I will get you scheduled for that May date.
Oh, perfect. Well, let me just, I can just write you a check?
Absolutely, or we do take credit cards as well.
Oh, no, I'll just write a check.
Okay, perfect.
Okay, so we just saw Colleen successfully close a procedure with Beth. And that is the complete 8 steps to a successful sales consultation, a process that we've developed here at Akara, and we have trained hundreds of practices nationwide and have increased conversions for all of those practices. Now it's time for question and answer. If you haven't already typed in a question into the dialog box, the question box on your screen, on the dashboard, please do so now, and I'd be more than happy to take your questions and do a live Q&A. Thank you.